Hello, hello, hello. Good afternoon, my lovely, beautiful peoples. Thank you all for joining us today for the Carticulture info session. We're going to give you all a few seconds just to have everyone kind of get situated. We do have a packed schedule for you all today, so we're kind of going to go ahead and get through it momentarily. Before we begin, I wanted to see if I could look at who's in the room. As you guys are kind of coming in, we did look at the roster. We had a nice diverse list of organizations that have already been participating in Carticulture, but they have new staff, and those are the new staff members who are on this call today. Some organizations that attended yesterday's festivals and projects grant, so they're interested in, from that perspective. There are also a handful of folks who have signed up with personal email accounts. So I'm not sure if they're actually card holders or just individuals in our community who are excited to learn more. So thank you all for joining. So again, all right, we're gonna go ahead and get going. So today, like I said, we do have a packed agenda for you all. The top row are actually representatives from our respective state agencies that are partnered with us to bring Carticulture to life. Each of them will introduce themselves and their respective programs. On the bottom, you have myself, Greg. I'm the coordinator for the Carticulture program. And Kaylin, my colleague, actually, fun fact, spearheaded the program in 2017 up until early this year. She has graciously offered to help us out as today's moderator. So on that note, as we go through the presentation, if you have any questions, please use Zoom's Q&A feature to ask your questions, not the chat. It gets a little crazy when we kind of use the chats for that. So just stick to Q&As. Like I said, it is a jam-packed schedule. So in the event that we cannot address your questions by the end, even though we have some time allotted for that, we will be following up with everyone who registered for today via email with answers to all the questions that are asked. And in that email, we're also going to go ahead and include a link to this recording once it gets posted onto our YouTube channel. All right, so moving on. This is today's agenda. So essentially everything that we have to cover falls into these four categories. I will give you a very brief overview of Carticulture just to give those of you who are new to the program some context before our agency partners step in to introduce their specific programs. Then we'll go back to me and I'll talk more in depth about Carticulture specifically. And that'll include a lot of the daily operations, the logistics of what it entails for organizations that are actively participating in the program. So again, the main mission for Carticulture is that we are making cultural programming accessible to low-income and working families across the Commonwealth, specifically by breaking down the financial barriers that prevent full participation. So I really, that's going to be the through line that we're going to echo throughout this presentation. And in so doing, we're able to foster community connection between cultural doers and the people within our community. And we're also able to raise the importance and relevance of accessing arts and culture. So I really want to drive that point home because it's going to be echoed throughout today's presentation. And in terms of what Carticulture actually is, so it's a program in partnership between us, the Mass Cultural Council, and 3 other state agencies who will present momentarily, and over 300 cultural organizations across the state. And together, we enable specific populations to get access to museums, performances, and other programming, other cultural programming, either at steeply reduced rates or for free of charge. So now I'm going to pass it on to Mary Laughlin from the DTA to talk a little bit more about the EBT program.
Hi, good afternoon, everybody. As you said, I'm Mary Laughlin, and I'm with the Department of Transitional Assistance. I work in the SNAP Outreach Unit as a coordinator. So our mission at DTA is to assist and empower low-income individuals and families to meet their basic needs, improve their quality of life, and achieve long-term economic self-sufficiency. Right now, DTA is serving 1 in 7 Massachusetts residents. We have what's called a program scorecard at mass.gov. So these figures right here about the program enrollments are as of September 22. So right now we have 630,297 SNAP households, and that equates to over 1 million recipients spread out across those households. For the TAFDC households, we have 37,968, which equals 97,847 recipients. And then for our EAEDC households, we have 28,406, which equals 28,633 recipients. So you can see we have a lot of card holders. Some SNAP recipients may also be on one of the cash programs and vice versa. Okay, next slide, please. So what are these programs? DTA manages the Supplemental Nutrition Assistance Program, SNAP, formerly known as food stamps. Our cash assistance program is transitional aid to families with dependent children, TAFDC. And then we also have our other cash assistance program, emergency aid to the elderly, disabled, and children, EAEDC. Now, I just wanted to mention different ways folks can reach out to DTA if they want to submit an application for any one of these three programs. They can do it over the phone by calling the DTA assistance line. They could go to dtaconnect.com, or in the case of a SNAP application, they could fax or mail a paper app to our document processing center in Taunton, and that's the address and fax number right there. Folks are also welcome to come into one of the local offices and apply in person as well. Next slide. So SNAP, what is it? It's a federal nutrition program administered by DTA that provides a monthly benefit to buy food. So who's eligible? You must be low income and a US citizen or an eligible immigrant, restrictions apply. By virtue of applying for SNAP, it does not make you a public charge, okay? And eligibility depends on both financial and non-financial criteria. So your income must be at or below 200% of the federal poverty level. And right here on the right is the SNAP eligibility chart, okay? So the middle column are the income guidelines based on the household size. And then the last column is the maximum monthly benefit you could get, okay? So if you're a household of one and you gross less than $22.65 a month, you should consider applying. And the maximum benefit you could get for your household size is $281, okay? Now, the last column, which is the benefit amount, these figures recently went up with the cost of living adjustment that just happened on October 1st. The middle column, which is the monthly income before taxes, the maximum monthly benefit, 200% of the federal poverty level, these figures increase every February 1st. So these figures will be in effect until February 1st, 2023. Next slide. So just a little more information about TAFDC, Transitional Aid to Families with Dependent Children. It's an economic assistance, what we also call cash benefit, that helps pregnant individuals, families, and caregivers of children 18 or younger. So eligibility is based on income, and we provide 2 cash payments per month. Okay, those benefits can go on an EBT card, or they can also get direct deposited to a client's bank account. Next slide. EAEDC stands for Emergency Aid to the Elderly and Disabled Children. It's an economic assistance program for disabled individuals and adults over 65 that are waiting for supplemental security income SSI payments to begin. Again, that also provides 2 cash payments per month. Next slide. So these are what the cards look like on the right. The card is valid with or without a photo. And then the bottom card is the PEBT card. So Massachusetts residents that receive SNAP, TAFDC, EADC, they get their benefits on what we call an EBT card, okay? The pandemic EBT cards are typically issued to the eligible children in the household. So if there's several children in the household, they each might have their own card, okay? TAFDC and EAEDC recipients can also get their benefits deposited in their bank account if they so choose. And again, the cards are valid with or without the photo. Next slide. So we do have flyers. This is a hyperlink right in the PDF or the PowerPoint that will take you to these nice flyers we had made up. We definitely do promote this program heavily with, I work with our outreach partners. I talk about how awesome this program is all the time. Please encourage folks to visit. We do promote it on Twitter. And then we also, here's the link to on mass.gov for more information about the Card to Culture organizations. You can pull up the full listing, and then it has all the information about the individual organizations. I think that's
Mary, thank you so much.
Thank you.
Appreciate you. So again, if you have any questions specifically toward any of these programs that Mary mentioned, we're going to go ahead and address those at the end. Next up, we have my good friends Karen and Alicia from the Department of Public Health, who will present on the Women, Infants, and Children WIC nutrition program.
Hi, everyone. As mentioned, my name is Alicia High. I am the WIC Health and Human Service Coordinator at the PH WIC Nutrition Program. Next slide. So I just want to kind of highlight what WIC is. WIC is a federal nutrition program that provides nutrition and health education, healthy foods, breastfeeding support, and other services like referrals to families who qualify. Next slide. To be eligible for WIC, who is eligible? We have 31 local WIC programs, consist of 122 sites statewide. Families can go to any WIC program that they desire. They're not restricted to go to a WIC program in their service area. And we provide services to low to moderate income pregnant and postpartum people and children up until the age 5. Most importantly, immigrant families are welcome at WIC, and you're on the program for 6 months if you are a postpartum individual, and if you're breastfeeding, you're on the program for 1 year. Moms, dads, and grandparents and other guardians of a child under the age of 5 may apply on behalf of that child. So this also includes foster parents. Next slide. How do people qualify for WIC? You can qualify for WIC by being automatic income eligible. That means that if you're utilizing, if you're an active TFDC or SNAP benefit client, and you're enrolled in certain Mass Health plans, such as Mass Health Standard and other plans, so you will be automatically income eligible for WIC. And if you're a foster child, you are automatically income. This means that you do not have to present additional income documentation. If you do not meet any of the automatic income eligibility criteria, we do have WIC income guidelines that fall within at or below 185% of the federal poverty level. And this is based on the household size and gross income. For example, a family of 4 can make up until $51,338. And you have to be a Massachusetts resident. Next slide.
Well, I'm Karen DiMartino. I'm actually the market and media coordinator for the WIC program. So I'm just going to jump right where Alicia took off. We currently serve 121,000 families throughout the state of Mass currently. However, we have about 85,000 card holders statewide, and we did a little breakdown just so you guys could see. Boston has the most amount of people, card holders. There's no photo on our card. This is what our card looked like. It's just a gold card, and there's 1 card per family, so there's no identifying factors on our card. So promoting the Card to Culture, we also use social media. We use our local WIC programs as well as our website. So with our social media, we actually have an Instagram account, Facebook account, and a Twitter account. We have about 15,000 followers throughout all our accounts. So we do have a large amount of families that follow us. These are just some of the examples of something I would post. We try to find anything that's happening. I try to post that on our social media accounts just to see if families would like to go and just keep them interested. We get a lot more during like school vacation weeks, holiday weeks, when people are really looking for something to do with their kids. And again, we use our local programs. We have 31 community coordinators, and they are fantastic. They hit the ground running. They're like our local voice on the in the communities. So they also have their own Facebook page where they also promote things basically in their areas, their own towns. They also attend any local events that are happening, and we also have a flyer that we promote this as well. So they'll use this and promote this in the communities as well. And again, we use our website as well, just like SNAP does. Our website is mass.gov/WIC, and we have a listing as well that is a searchable table. If somebody's looking for a specific organization, they can search for it right on our website.
Karen, thank you so much. Alicia, you as well. Appreciate y'all. So next up from the Massachusetts Health Connector, we have my good friend Jason, who's going to speak a little bit more about the different Connector Care programs.
Great. Thanks, Greg. And hi, everyone. Really happy to be here for the Health Connector. We started our Card to Culture program in January of 2020. We're really excited to get it going. And then obviously gave it a little bit of a break as events warranted. But we are the Health Connector. We provide health and dental coverage to people in Massachusetts who don't get it from other sources. You know, most people get their health insurance from their work. Maybe they get it from Mass Health or Medicare. But we're here for people who maybe have a job that doesn't offer insurance, or they just moved to the state and need health insurance, or they're going out on their own, starting their own business, but still need health insurance. So we provide health and dental to people. It's worth noting right now is open enrollment. It's our biggest time of the year. It just started last week on November 1st, runs through January 23rd. And it's a time of year when anybody who needs health insurance can come in and get covered. So it's pretty busy for us right now. You know, the one thing that we do offer, we're the only place where people can get help paying for their health insurance through state and federal subsidies. People can get help paying their premiums and some other parts of their health insurance. Greg, maybe go to the next slide. Great. The biggest way we do that, our biggest financial help is through what we call our Connector Care program. That's for people who earn up to 300% of the federal poverty level, which is up to about $40,000 a year, almost $41,000 a year. We currently have 135,000 Connector Care card holders. They are predominantly in gateway cities. You know, that's sort of the general, you know, where you're going to find our membership. This chart over here on the right details the income levels and the lowest premiums. And, you know, our lowest cost silver plan is $450 so a month. So if you're getting even a $48 or $90 premium, that's really helpful to people. Gets them into coverage, gets them to use their health insurance. Connector Care also has really low copays. You know, most prescriptions are $10 or $15. Doctor visits the same. I think ER visits are $50 in Connector Care. So, and there's no deductible. So the out-of-pocket costs are pretty limited. So we really do try to make it as affordable as we can for people. So let's talk a little bit about our ID cards. We know it's a little bit of a struggle because we don't offer the insurance. We connect people with private companies, the private commercial carriers, and so we get them enrolled. We take their payment, we send their payment to the carrier, and the carrier takes it from there, including sending them their ID card. So we currently have 5 plans that participate in Connector Care. Their logos are below. I will note always, you may have heard, is changing its name to Mass General Brigham, MGB, starting the first of the year. They're not letting us use their logo yet, so I wasn't able to throw that up here. So we have the 5 carriers who are all in Connector Care. They all have their own card. You know, a lot of the same information on these cards. They have a logo from each carrier, has their logo, and then somewhere on the card it will say Connector Care. Not everyone who is in Health Connector coverage is in Connector Care. I think that's important to note. But anyone who is in Connector Care, it's going to say it on the front of their card. The rest of this is all, you know, copay information, their ID number, their name is on there somewhere, but it'll say Connector Care somewhere. The example on the left is Fallon. They include the Health Connector logo. Tufts on the right, they do not include their logo. We have been trying to work with the carriers to make their cards a little more uniform. Particularly with this program in mind, we have not been able to make great inroads there. So right now we're at the 5. In 24, we'll be expanding, so all of our carriers will have to participate in Connector Care. So that would include Blue Cross, Harvard Pilgrim, and United. They don't have a ton of membership generally with us, and they have no Connector Care membership right now, but they'll come on board in 2024. So when we meet again next November, we can provide that update and remind you guys of that. So like I said at the top, we started this, we started promoting Card to Culture during open enrollment heading into 2020. So right about now, in 2020, we started promoting Card to Culture. We were really genuinely very excited about the program. We thought then, we think now, this is a great benefit for our members. And we'd love to kind of promote, a healthy and active lifestyle. Includes going out and seeing some of the great art and culture that we have in state. So, we'll do a lot of social media content. One of the things we do now and throughout the year is Facebook Live videos. We do them with, some of our sisters who sign people up for coverage. We do it with elected officials. And in 2020, we were doing it at some of the participating organizations. We love doing it. It's a nice change to talk to, the Stone Zoo instead of yet another healthcare wonk. So we had a lot of fun doing it. We want to do that again. I think one of the things also that we're planning for next year for our outreach and communications team, there's 7 of us. Our plan is at least one of us on the team. We're going to visit every single community in the state next year. We're going to hit all 351 cities and towns, one way or the other. So there should be plenty of opportunity for us to hook up with you guys and maybe get some good content out there. We're going to do member emails. We know we have contact information for all our members. We want to send them a regular email that say, hey, don't forget about Card to Culture, and here's some great things that are going on in your area. We'll break those down into 5 or 6 different regions of the state, so people are getting stuff, that's easily accessible to them to go and get to. I think we did 1 round of email in the winter of 2020 before COVID started. So we want to get that back. And then we do have on our website a devoted page to Card to Culture that has some background information about the program, and then the list of all the participating organizations.
Awesome, Jason. Again, thank you so much. To our agency partners, thank you all. I want to go ahead and do a quick, a temperature check. Kaylin, anything you think we should address now, or can we wait till the end to address any questions that may have been asked so far?
Yeah, there was one quick question for Mary about the pandemic EBT cards and who they were issued to during COVID.
Mary, would you like to address?
Yeah, I want to wait to give out the official response, because the short answer is it depends. At the start of the pandemic in March of 2020, who the cards were issued to is really different from where we ended up now. So there's been multiple iterations and distributions of the pandemic EBT benefits, and who got it when has changed. So I'm going to just get an official response from my agency, and then we can send it to everybody.
Awesome. Yeah, that works. Thank you so much, Mary.
Okay, thanks.
Perfect. All right. So now, again, my name is Greg, and I'm the program coordinator for the Card to Culture program. And now we're going to get more into the specifics of what is involved for participating organizations. So this snapshot is a bunch of push pins that represent where all participating organizations are. As of November 1st, we now have, I believe, 323 participating organizations. It's a wide, diverse group of organizations. We're talking about, from conservation, land nature centers to community music and craft schools, museums, performing arts venues. It's really a wide variety of participating organizations that's growing literally daily. And all of them are providing voluntary discounts for the Carticulture program. So let's talk a little bit about that. So in terms of the discounts, so like how are we actually structuring these discounts? What are they? We have to kind of go back in time a little bit. In 2017, when the program was first launched, we really had in mind of the idea of discounting one-time cultural activities. So these could be, to the admission rate to be able to access a museum or an exhibit, to attend a performance, a class, an event, a movie, what have you. So the price points that you see here are really pertaining to those one-time cultural events. So it's kind of mirroring your standard traffic light. So the dark green is really kind of the best situation. And I want to take you guys back to what we mentioned about the mission and the objectives. We are trying our best to break down the financial barriers that stand in the way of our community members in order to kind of engage in these activities. So if that is our goal, then free unlimited tickets, if that's an organization's discount, that's really kind of the best case scenario. Just before that, we have discounts that are under $5, where the cardholders would have to pay a rate of under $5, but still tickets are unlimited. Those are still great. The baseline, which is in light green, that's kind of where we see a lot of organizations enter into Carticulture. So their discount, they offer $5 tickets, and they'll limit it to 4 tickets per family. And then once we kind of really start getting into the yellow, we have a few organizations that are offering tickets that are over $5, and they're also limited. They'll either limit it to 1 to 2 or 4 people per family. Now, at the very end, this is kind of where it gets into a situation where, organizations are still eligible to apply. But if an organization, if the best that they can offer is a discount that is in excess of $20, and on top of that, it's, limited, whether it's 1 to 2 or 4 people per family, that I love the intention, I love that, but it really kind of goes against, it's at that price point, it really starts to become an inaccessibility issue when we're talking about breaking down financial barriers. In addition to that, in addition to kind of using these price points, this spectrum as a guideline, discounts should also be for admission to every regular season performance or event, not just to specific shows. It should also be available during all normal operation hours or operating hours and can be applied at any time. It should also be administered through your regular process. So whatever normal protocols that you basically have other discount programs kind of navigate through your programs, this should kind of be the same thing. It really shouldn't deviate for cardholders or for Carticulture discounts. Now, what other discounts can we offer? This is actually what's really exciting. So we've been seeing organizations apply offering a discount that kind of falls outside of that framework that I just presented. And the common groups of those types of discounts are, my most favorite, to be honest with you, are tuition assistance. So these organizations, basically, they've structured their discount language to be tuition assistance towards seasonal programs. And these programs will they exist as we do, like college programs will be like fall programming that'll start from September through December, or from February through April or May. And what they do is they will automatically they'll automatically qualify cardholders for their financial aid policies. We've also seen groups offer free annual memberships or tours. We've also seen organizations offer discounted prices toward their products, even studio time. I recently received an application from basically a studio where people go and record music. So they want to go ahead and offer a discount toward those rates for reserving their studio space. And lastly, this is also a really cool thing that we're seeing too, is organizations are using as their discount a pay what you can model. So it's really kind of meeting, the point there is really meeting all folks where they are financially. So those are some of the things. And again, this is not at all an exhaustive list. This is actually, to be honest, what is most fun about the program. Depending upon the type of programming that you do, however you would want to structure your discount, it's really based upon what it is you as an organization has the capacity to discount. So let's have a conversation with that. Again, this is not an exhaustive list, so any thoughts that you have that might not be represented here, I'd love to have a conversation about that. So now let's talk about once you are, let me backtrack a little bit. There's something on my screen that's just annoying me and I can't get out. Okay, never mind. So now once an organization is actively, involved in the program, these are the things that they are required to do. Pretty straightforward, as you can imagine. So first, they consent to have their discounts listed on our agency partners' website. So what our agency partners mentioned in terms of the website that has the complete list of organizations that offer discounts to their cardholders, that's the website that you are consenting to having your discount listed on, in addition to any other promotional materials that we put together. For example, some of the flyers that you saw earlier. Organizations also commit to offering their discounts from the time that they sign up through the end of that calendar year. So hypothetically, if you signed up tomorrow, you're basically committing through December 31st. And the way the process flow happens is that we'll send out a communication late in December. This year, it'll fall on December 20th, letting folks know that if they'd like to opt out of the program before the start of 2023, to just send me an email, respond to the email letting me know. Any organizations that don't, we basically automatically enroll you into the next year. Then you're basically committing to participate through the entirety of 2023. So organizations don't have to reapply every year. It's basically an automated thing. Next up, organizations have to train their box office and admission staff ahead of implementing the Card2Culture discount. It's really important that staff understands how to administer the discounts and what to expect before cardholders start walking through your doors. Next up, once your staff is trained, then we kind of transition into publishing the discount on your website, and you would want to reference not only the Card2Culture program, but the Mass Cultural Council and our partner agencies. And we have plenty of guidance on how to go ahead and do that, so no worries on how to get that situated. And then at the end, really, really throughout, you want to go ahead and track the discounts that you are offering with the specific goal of actually reporting on that number once a year. And we're going to talk a little bit about that later. So now this slide here is for new organizations. So those of you who are new, who have never engaged with Mass Cultural Council and you do not have an account with us, the link here is where you would go to create an account. So the button at the the bottom left where it says register, that's where you would click there to go ahead and register your account. You would actually be creating your individual login and creating an organizational profile for your organization simultaneously. However, as you go through that process, if any aspect at all kind of trips you up, the email at the bottom of the screen is the email address to contact, and our grants team will help you get your account situated. Now, once you create your account and you're all set, or if you already have an account, the next step is to submit the application. It's a very straightforward process. So once you are on your homepage, just go to our current opportunities section. That's going to be on the top left. That's actually where all upcoming grant programs, the applications to those programs lie. Just scroll down to Card2Culture, click the Apply Now button. The first page is really where you would list the person within your organization who will serve as the Card2Culture point of contact. In many cases, the person that has created the account, they'll list themselves. That's completely fine. For mid-size or larger organizations, they'll usually delegate a different person, for example, like their box office manager, to serve as the Card2Culture contact. Again, it's a straightforward process of the application, so I'm not going to go over all the questions, only the ones where there's always kind of a little bit of a back and forth. So the first one is the discount text. So after you indicate which discounts you want to offer, if it's going to be to EBT, WIC, and or Connector Care, a text field will populate, and that'll be where you'll put in your actual discount language, and that language verbatim will be copied onto our agency partners' websites. Very few organizations get this. I don't believe in perfection, but for lack of a better word, perfect the first time out. This is actually what I will work on with you to kind of structure that language. So don't stress at all in trying to get that right first time out. The next field, there's an area where you'll put the name of your organization. Don't put your legal name, put the name as you would actually want it displayed. And then the organization URL. In the beginning, when you first submit your application, just put your homepage for now. And then once your application is approved and you train your staff, and then you actually update the language on your website, After organizations go through that process, sometimes they'll create a separate Card to Culture page, and then that's the link that we'll want to go ahead and put back into your application. That way, we are directing cardholders to the appropriate place on your website. And then lastly, this is really just kind of a technical thing. We have 3 fields for organizations to input their Facebook, Instagram, and Twitter links. Don't put the hashtag. Literally kind of just copy the website address for each one of your social media links and paste it into those fields. And then once you submit the application and you're approved, then the next phase is in training staff. So this isn't a one-time thing. This is really kind of an ongoing process. This kind of entails a lot, but I'm not going to go over all of the finer points, just really the broad strokes. The top link that you see here, resources for organizations, a lot of helpful information specifically pertaining to training your staff exists on that page. There's actually a communications and signage guide that we have that really kind of breaks down a lot of those processes. So the first thing you would want to go ahead and do is navigate that web page and add any relevant materials to your training standard operating procedures. And as your training staff, so FOH, your front of house staff, ideally you want to train and inform all staff members that you guys are participating in the program, but especially you want to make sure that your front of house staff, your box office staff, your ticketing folks, those that answer the phones, fully understand how to address the following. So first, you would want to make sure that your staff is competent in answering your organization's involvement in Card to Culture. That also specifically that would entail the discount that you're offering and any instructions that cardholders would need to follow to receive the discount. If they have to call or email ahead of time, if there's a specific discount code that they have to use, whatever those protocols and policies are, make sure that your staff is fully aware of what that process entails. Next, you want to make sure that your staff can identify the cards. And to address the point that my colleague Jason had mentioned, the communications and signage document has currently the 5 Connector Care cards on there. However, as the new healthcare insurers kind of come on board, I'm going to go ahead and update that document, and I'll just send it out to all approved organizations to make sure that you have all the information once it's approved and kind of ready to go. Next up, you want to make sure that the process for applying discounts, and again, the process for doing that, you want to make sure your staff understands how to do that. So if you are using a merchant processing system, just make sure that they're familiar with that process. And also, if there is tracking that you're going to have your staff do, just make sure that they are familiar with that process as well. And actually, just to kind of make mention, the document here on the right side, or I'm sorry, the left, in the past, we've actually helped organizations develop kind of a cheat sheet for their front of house staff, and that's very helpful. So any signage or flyers, or in this case, cheat sheets that you could have available at your front desk, I'm a big proponent of that. I don't think it's required that everyone has to have everything, memorized. So things like that, if you think that things like this would be helpful, I could definitely work with you in kind of creating something like this specifically for your organization. All right, and then once your staff is trained, now the next thing is kind of to transition into communicating your involvement in the program. So really simplistically, that's going to be updating your website and collateral. So the first thing you would want to go ahead and do is add your discount offering to your website and wherever else you regularly advertise discounts. Make sure you include any relevant instructions that cardholders need to follow. Make sure that information is clear, particularly on your websites. And again, like I said, once you kind of get this part situated, you'll send me a link to where this information exists on your website, and I'm going to go ahead and add that link and update it on your application, so our agency partners are directing cardholders directly to that correct place. Next, you'll want to reference the Card to Culture program, Mass Cultural Council, and our agency partners, and I've actually linked those websites there, and those links also exist on our communications and signage guiding PDF as well. And then lastly, we want you all it would be great if you could also link back the full list of participating organizations that are offering the EBT, WIC, and Connector Care discounts. Even if you yourself are not offering all three, it's still helpful if you could help spread the word. So if you got to keep in mind, these are going to be card holders that are accessing this information. So it's very, very possible that they won't be aware that there are other organizations within their communities that are also offering discounts that they could take advantage of. So helping us communicate that would definitely go a long way in again, making the program more accessible to more folks. Now, tracking, this is very simplistic. I feel like it sounds like it's heavy, but again, we want organizations are voluntarily participating in this program. So to that point, we want to make that process administratively as kind of efficient and easy as possible. So once a year, in this case, the timeline is going to be February 10th. That's going to be the deadline to submit the final report. Later this year in December, we're going to send out an automated notification through our GMS, our grant management system, informing organizations that the annual report is now live and that organizations can go ahead and enter their data. It's even more straightforward than the application. We're really just going to ask what is the total number of EBT, WIC, and or Connector Care discounts that you offered for the 2022 calendar year, not the fiscal year, but the actual calendar year. So Jan 1 through December 31st of 22. And then if applicable, if you offered any child discounts as well. And then lastly, there are two fields where, and for these last two fields, we've actually gotten some great data. So those two areas are spaces where you could write in any staff testimonials or guest testimonials, any comments or feedback you might have received from card holders throughout this process. We've gotten some great bits of information in those two last fields as well.
Yes.
Beautiful. So as you're actually implementing these programs, here are some things to keep in mind. EBT, WIC, and Connector Care cards are not actually used to pay for admission. So the programs that are administered through our agency partners may or may not have cash benefits that are used on the card, but visitors to your organization do not pay with those benefits. They pay with credit card or with cash or with any other type of money that you accept. The other next piece is anyone who shows up with the card should get the discount. So in some of it depends on the exact particular program, EBT, WIC, Connector Care, whether there's one card issued per household, whether there's one card issued per qualifying member in the household, and not all of the cards have the photo of the primary person on them. So it's not always going to necessarily match the name of the person who's showing up at your organization. And related to that, we recommend that you don't ask for additional photo ID when you are checking their card. We just feel it's not necessary. It really might not give you the correct answer about whether the person is engaged in these programs with our agency partners. And it's an additional barrier that goes against the intent of this program. I see that Greg has rejoined us, so I'm going to let you step back
Hi,
in.
everyone. I got booted out of my own info session. Thank you, Kaylin. Again, Kaylin's awesome. Thank you. And sorry about that, everyone. Yeah, so that slide has already been taken care of. So this is the last one that I really want to go ahead and close out on. So we talked a lot about who's involved, obviously, what the program entails, the whens and the wheres. We really haven't kind of covered the why. So I wanted to go ahead and end on this one. So I'm going to go ahead and share actually oh, thank you. There we go. Perfect. So this is actually a tweet that we had received a week ago today, actually, on our Twitter feed. And it's from a card holder whose name I blocked out for privacy. And I'll just go ahead and read it to you. So it says, disabled 10 years ago, I lost everything. I thought I'd never physically or financially be able to enjoy museums and performing arts again. After 1.5 years of PT, my first outing not to medical care was to the Peabody Essex Museum using my SNAP card discount. Thank you for Card to Culture. So this really is the driving, motivating factor as to why we do what we do. And all of our agency partners, on the staff here at Mass Cultural Council, all of our cultural organizations, even the cardholders themselves play a huge role in this. And this is something I didn't mention earlier that I'll mention now because we have the time to do it. In terms of our partnerships, I kind of see cardholders as part of that process, and here's why. Since I came on board in March, there's actually been a lot of organizations that were new that reached out to me specifically because someone had called them asking, who was a cardholder, asking if they offered either EBT, WIC, or Connected Care discounts. So cardholders themselves play a huge role. They're very much influential in helping new organizations learn about the program and eventually participate in it. So thank you to everyone who's played a role in that. And lastly, we are good on time, so this is perfect. We'd like to open up the floor to the questions that you asked to see if we could get some of those answered.
Great, and keep putting your questions into the Q&A feature if you have questions. Greg, I'm going to read one to you. It says, if we are a small company with limited runs, would offering free and or discounted tickets for specific performances, i.e. Tuesday nights or one specific date in the run, would that make us ineligible to participate in this program?
Excellent question. Thank you for asking. So I want to shift this terminology around eligibility for a moment. So the blog that we recently put out there, it correlates the Card to Culture program to the Stone Soup storyline. So for those of you who haven't read it, not the blog, the actual Stone Soup poem, basically it really kind of, for me at least, it really conveys the power of what a community can do when its people kind of come together. So the idea of your discount offering being what you can bring to this kind of community party, there is no eligibility. It's a matter of capacity. What do you have the capacity to offer? And what we do is we'll work with you to make that as accessible as possible. So if that is the best that your organization can offer, especially given the fact that you're a small organization, I want to work with you on that. We want to work with you on that. So let's go ahead and talk. Anyone who has questions about that in terms of whether or not what it is you'd have to offer, if it's quote unquote good enough, I really want to kind of move away from that, because it's a matter of, if you want to participate, if your intention is there, then we want to work with you. Everything else are just the specifics that we could go ahead and work out. So still go ahead and reach out, and I could specifically work with you on crafting something that is going to be feasible for your organization, given its smaller size, on what you guys can go ahead and do.
Great. Another question is, so far all of my programs are free and I don't check cards. Is that a problem?
Yes, and I apologize for not mentioning that earlier. So you are that dark green. If you are already doing free programming, whoever shows up to your events, that's the ideal situation. So in your case, the only thing that really changes, the discount language, that's very easy in terms of how we would craft something like that. And again, I'll work with you on doing that. The only thing that really shifts, though, is what you would do, what you would enter in that final report. There is a drop-down field where whatever numbers you plug in, if you could actually say that they are an estimate. And basically that's what you would go ahead and do, which might be difficult, but to the best of your ability, you would want to go ahead and enter the numbers, your estimated numbers for what your events brought in. Again, that might be difficult to do, so it's just an estimate. Those numbers, any estimated numbers, we don't factor in to that year-end overview that we keep adding to. As of the end of 2021, 780,000 discounts have been administered. So anyone who's providing free programming, those numbers don't count toward that, but that's how you would go through that final report. But we definitely would still love to have you be a part of the program.
Great. And the last question that's in the Q&A right now is, we may have different opportunities throughout the year. Unfortunately, we do not always have our entire calendar year's activities that far in advance, since it depends on staffing availability. Would there be a way to update our offerings throughout the year? Yeah,
we're definitely flexible. And I didn't say this earlier. So I connect with our agency partners who you see here. What I say, the baseline is quarterly. So on a quarterly basis, we update that massive website that they all have that displays the full list of participating organizations. Because we are currently running the Festivals and Projects Grant Program, and applicants to that program will be prioritized if they're participating in Card to Culture, we are now getting kind of a slight increase in submissions. So because of that, The last time that we'll update the websites will probably be in December. But for something like that, if your programming is dynamic to such degree that you kind of have to shift it throughout the year, even though we're saying that you really want to kind of commit to it throughout the whole year, again, let's work on that. As long as it's not too dramatically different each time you're making those shifts, we could definitely work with you on that. So yeah, that's not a problem. Let's just go ahead and speak offline specifically in terms of how we can go ahead and do that for you.
Great, Greg, we did get 2 more questions in. The first is about tracking and getting EBT card holders from other states. Do we need to track Massachusetts separately from other places?
That's a great question. Yeah. So, okay. So EBT and WIC do have cardholders from other states. If you choose, that's entirely up to you. If you as an organization choose to accept EBT and WIC discounts from other states, that is awesome. Do you have to track them separately? If you can, if it's not too burdensome of a process, that would be great. Honestly, though, if you merge those numbers for your Massachusetts numbers and submit that, that's not the end of the world. Again, we want to make this as seamless and easy as possible. So if you can make those distinctions, that would be great if you did. If not, don't worry about it, but that would be great. But again, it is your determination if you decide to offer WIC EBT cardholders from other states discounts for this program.
And now, Greg, the last 2 questions are about application deadlines. So if an organization has programming in 2023, should they wait? Should they apply now? And
Apply
then,
now. Yeah. Sorry, go ahead, Kaden. Sorry.
well, great. That's a nice and succinct answer. Apply now.
Yeah, there is no deadline to Carticulture. It's actually a rolling application. Yeah, so I think that question is more specific to organizations that, let's say that they do just 1 week-long festival, for example. Yeah, that's fine. So, and there were some, I don't know if Chris might have answered that. So there's an organization that's doing like a Pirates festival in July, I believe, who I've been speaking to, and I know that they registered for this call. So if that's the case, no, feel free to go ahead and apply now. We could get things kind of situated as your festival or your event kind of gets more concrete. It's really what's best for you. There's no deadline to apply. It's a rolling application.
I will mention that organizations that are participating in the Card to Culture program are being prioritized to receive funding through another one of our grant programs, the Festivals and Projects Grant Program. The deadline to apply for that Festivals and Projects program is December 15th, 2022, for activities that have happened, so it could be retroactive back to July 1st, or activities that will happen before June 30th, 2023. So if you are interested in applying for the Festivals and Projects program and you want to get your bonus points for participating in Card to Culture, you would want to get that wrapped up to be part of your application by December 15th.
Thank you, Kaylin.
And then the last question is also a little bit about deadlines, asking for social media about events. How do you handle that throughout the year?
So this is something that we're kind of piloting. So starting last summer, what I did was I'm working with our agency representatives, and I am reaching out to all participating organizations bi-monthly, so every 2 months, so essentially saying, hey, for the next 2 months, let me know what you have going on. So for example, on October 15th, I sent out an email to all 300 plus organizations asking for their upcoming events happening between November 1 through December 31st. And there's an Outlook calendar that I've created where I'm plugging in all of their content and any images, flyers that they might have submitted along the way. All that's on the calendar. So as Karen briefly touched upon it, so Karen in WIC's case is the person who does a lot of those social media promotions. So what they go ahead and do is they look through that calendar and they'll craft social media posts based upon the content that I've compiled that you have all submitted to me. So that's kind of a tedious process, to be honest with you, but I like it because I get to see what everyone's kind of doing. And it is entirely on our agency partners in terms of what they decide to promote. So because you might respond to my email doesn't necessarily guarantee that a social media post will be created for it. It's entirely up to their discretion. But that is how we are able to promote something that's other than your general discount, we're able to promote your specific events and programming that you have going on. And again, for me personally, it's really amazing to kind of see what you guys are all doing as we kind of navigate through that. So the next time that email will go out will be on December 15th, around there, and it'll be asking for what's happening between Jan 1 through the end of February.
Greg, we have a question about, do you have any ballpark statistics about the usage of the discounts so that people could plan and work it into their budget? How many should they expect at each event?
Yeah, so that's another great question. So one of the things that we're looking at, we can, we have that data. It might not be as regionally or city specific. So the information that participating organizations enter into the final report is just how many discounts they offered. But because we know where they're located, there is some way that we could kind of parcel that data. So we could do some digging to see if we could get you some specific information on that front. The other thing that I wanted to mention on that, it kind of correlates to another question that we've been asked. So Karen and the WIC team, they actually presented a regional map of where their cardholders are based. That will also serve as a good indication in terms of what the pipeline might be for your organization if it were to offer a discount. So there are factors that we could help you, that we could provide you with to help you frame how, like what the response would be once you quote unquote go live. If that is a concern, if there's a concern that if you were to go live, you might be overburdened, I would say start small. Start with probably limited ticket offerings, even though, you know, that's not the most accessible, but at the end of the day, we want this to be something that's feasible for you. So start in a context that works for you. And as you kind of get the wheels kind of greased up, so to speak, and you get used to the program, you could always make your discounts more accessible by making them less expensive. So that's kind of, I think that question was kind of framed more so from that perspective, in case it was. But yeah, so we just go ahead and connect with us and I could give you what data we have.
That's everything that has come through the question and answer feature. There's a question in the chat about what should I do next if I still have questions? If you reach out, so if it's about the Card to Culture program, reach out to me specifically. My email address is here, greg.torales@mass.gov. If it's a question that's really more suited to one of the specific programs, EBT, WIC, or Connector Care, I will share those questions with them, get their answers, and relay them back to you. But yeah, just communicate. Again, I love engaging with people if you haven't already figured that part out. So I love to have conversations about this. So just go ahead and reach out to me. I'll send you a link. We could go ahead and connect on Zoom or phone, whatever the case is. We'll just have a conversation on how you can get started. If you already know that you want to get started, then just follow the instructions we provided to you to access the application and complete one. Awesome. All right, I'm seeing some of the comments. So I think, yeah, I think that is it. Thank you all so very, very much for being a part of this today. Again, this is the first iteration. I definitely want to have, we want to have more conversations happening with you all. So again, what we're going to go ahead and do is we're going to download the questions, and I'm doing that now. That were probably posted in the chat, save chat. Okay, that's done. All the questions that you have asked through the Q&A, we're going to go ahead and export that. Once this recording is processed, less the part where I got booted out of my own session, we're going to go ahead and make that recording available to you all via our YouTube channel. So once that goes live, we're going to send an email out to all those who registered with those answers, with the live link as well, and we will go from there. So again, thank you all so very much for being a part of it, and we will be in touch. Have a great rest of your day.
Thanks, Greg.
Thank you all.
Greg.